A big part of the mission for the organization Cherished Mom is to educate, encourage, and empower new moms. And right now, Cherished Mom is teaming up with the Appalachian Perinatal Health Alliance on a webinar series called Survival Mode, Parenting in the Time of COVID. And here to tell us more about this webinar series is Dr. Diana Moreland. Doctor, thank you for taking some time with us today.
My pleasure. Thanks for having me.
Let's talk about this webinar series. You've already had one webinar. Tell us about that and tell us what's going forward.
Absolutely. So we at the Appalachian Perinatal Mental Health Alliance, in partnership with Cherished Moms, we know that parenting is so hard under the best circumstances, and we recognize that parenting during a global pandemic is even harder, and it's really uncharted territory for everyone. So we wanted to come together to create something to offer support to families during this time of COVID. And so we've started a webinar. Last week was our first one ever, and we launched it on parental self-care, how to take care of ourselves as we're working to take care of others and our families. This was recorded, so folks can see this webinar on www.cherishedmom.org/survival mode. And in it, I discussed just how important it is for us right now to normalize how challenging it is to be a parent on a good day and how extra challenging it is to be a parent in the midst of this pandemic. And so how we need to normalize that it's okay to have lots of big and hard feelings as parents. It's okay to not be okay. And we really need to lower our bars of expectations for ourselves as parents. I also talk a lot about how we need to notice these thoughts that we all have as parents, what I call the parenting shoulds, where we kind of in our minds tell ourselves that we should be able to do a lot of things, and then we feel guilty that we're not. So maybe we should be cooking more, we should be playing more, we should be cleaning more because of the pandemic. And really, this is a time when we should be slowing down, giving ourselves lots of grace and compassion, and working to take care of ourselves as we take care of our kids in these really hard times. So folks can see that webinar online, again, at cherishedmom.org/survival mode. And then we've got some great webinars coming up. So this Friday at noon, we're going to do a live webinar where folks can call in and participate. And this one's going to be around perinatal mental health. So mental health during pregnancy and postpartum, recognizing that, again, pregnancy and postpartum is a hard enough time when everything goes well, and when you're struggling with some mental health challenges like anxiety, depression, stress, trauma, it's even harder. So we're going to have myself, I'm a licensed clinical psychologist, and we'll have a licensed counselor as well, and we'll be answering questions and talking about what mental health may look like in pregnancy and postpartum and how to get help during this time if you or a loved one needs it. So that's this week, and then our third webinar that we've got planned so far is a week from Friday at noon, and we'll have a certified nurse midwife talking about pregnancy during this time of COVID and how pregnancy and delivering might be different in this time of the pandemic. So those are the three we have planned, and then we're really welcoming feedback from our community on what they want to hear about and how they want to feel supported during this time.
I've got to ask this question because it is I think it's on the forefront of a lot of people's minds. It would be so difficult right now to go in for delivery right now, for delivering a baby right now. Just the stress of knowing I've got to go to a situation I may not want to go to. What kind of advice, what kind of information are you getting out there for ladies going through that?
It's such a great question and such a big one. I think first and foremost is normalizing that it's okay to have hard feelings. It's okay to feel scared. It's okay to feel stressed. And it's okay to feel sad that this isn't the pregnancy experience that folks maybe expected they would have. I think there's a lot of loss right now on all fronts, but specifically related to pregnancy. People have these hopes and dreams of what it'll be like to be pregnant and to deliver. And COVID is changing everything for our pregnant women and families right now. And so noticing that loss, talking about it with somebody you love and who supports you, and trying to plan and think about what you need to take care of yourself in this time and with all these changes going on around COVID, and then be open to change, because that's something that's, I think we're all being forced to remember right now, is how little control we have, and recognize that it's okay to want control and to wish we knew what was going to happen, and then to normalize the feelings when we realize we don't necessarily get to have control, and trying to find support and find ways to cope in light of that.
And you mentioned it just briefly there, but the feedback you got, especially from that first one, from your first webinar, what's the feedback been like on that first one? And are you expecting a lot of calls and everything on your second one?
Absolutely. It was we had way more folks than we were expecting. We had over 200 folks join either live through the webinar or on Facebook Live. So we were so excited. We had folks across the state joining. And really what I was hearing is just that we need this, that we need to talk about this, that folks feel alone in this, and that it was really important just to come together, to feel connected, and to remember that we're not alone, that everyone's struggling, and that it's nice to feel like you're a part of a community even when we have to be isolated to our homes.
All right. Dr. Diana Moreland, thank you so much for taking some time with us today. We're going to have the information up on the screen for these webinars that are coming up. Thank you for what you're doing and staying strong together. I think that's the key.
Absolutely. Thank you so much.
Thank you so much. We've got that information for those webinars coming up soon.